During this online lecture, I'll be covering the topic burns. Burns can be either physical or chemical, and they cause damage to the skin. They can also affect the mucosa, but we're going to be focusing on the skin for this lecture. The most common sources include heat, fire, electricity, radiation, and acid or caustic agents. Caustic just means that a chemical has the ability to burn or corrode tissue, in this case the skin. Burns can be classified as first, second, or third degree, depending on how deep and severe the penetration is of the burn to the skin surface. So when we look at a first degree burn, it's more superficial. It's affecting the epidermis, remembering that that's that outer layer of the skin. The burn site will be red, it'll be painful, it might get dry, but there are no blisters when we talk about first degree burns. So a mild sunburn would be an example of a first degree burn. Second degree burns are more of a partial thickness type burn where it involves the epidermis and part of the dermis, that layer beneath the epidermis. And you're still going to get redness, pain, but swelling and blistering are common features. A third degree burn, which is more of a full thickness burn, these destroy both the epidermis and the dermis. They can also, depending on the depth of the burn, can cause injury and damage to the bones, the muscles, and the tendons in that area. In these cases, depending on the extent of it, the burn site can appear white or have a charred appearance. The person will lose sensation in the area because nerve endings are destroyed. We can estimate the extent of a burn using what's called the rule of nines. So please make note that what we're talking about on this slide is called the rule of nines. And so the body can be divided into 11 areas for quick estimation. And each area represents 9% of the total body surface. So what we can see here is that the front and the back of the head represent 9% total. The front and the back of the arm represent 9% total. The chest and abdominal areas of this whole region here is representing 18% just at the front, and then the back 18%. So it really is roughly 9 here and then 9 down here, making that 18. And then the front of the leg, 9%, makes sense that it's a greater number than what you would see with just the front of the arm. And then the back of the leg, 9%. And then the perineum area represents 1%. So this is the area surrounding the genitals. And so this allows you to estimate the percentage burn of a person's body if they experience a burn by using the rule of nines. Here are some images of different examples of burn and severity. You can see blistering and swelling in this person's foot. I believe this was a scalding injury where boiling water damaged the child's skin. Another burn here. This is one that required skin grafts because the damage was extensive enough that healthy skin had to be taken and used as a skin graft to replace the damaged tissue in this person's extremity. This was a pretty bad burn that has left a lot of scar tissue, so the skin never healed. And when it comes to this, the scar tissue can become a problem because it can really limit the person's range of motion. It's not flexible. And then here is an example of showing you the vocal cords. Now this isn't the skin, this is more getting into mucus area, but I wanted to show you normal versus the inflammation that you can see present here. And this is because in this case, somebody had inhaled toxic fumes. It caused burning, which led to so much inflammation and swelling that it obstructs the airways. And this is a situation where somebody might not be able to get enough air into their lungs, and so they would need to be intubated to open up the airway and provide air more directly into the lungs or into the branches that lead into the lungs. Some examples of complications after a burn can involve systemic effects. This is quite common, and fluid shifts are an important consideration. If there's damage to the blood vessels, fluid within the vessels can leave and end up in the interstitium or the interstitial space, which is in between cells that make up tissue. So it's fluid leaving vessels and entering into the tissues, and this in itself, we'll see this on a later slide, can lead to hypovolemic shock, or this is a contributor because we lose so much blood in the vessels that there's not enough volume of blood within the vessels to reach tissues and perfuse them so that they can survive. Potassium, as I'll show you on the next slide, can escape from cells, and when it escapes from cells and ends up in the blood, and there's higher than normal potassium in the blood, this can lead to hyperkalemia, or this is called hyperkalemia, higher than normal levels of potassium in the blood. With burns that are severe enough to damage muscle, this can cause myoglobinuria, which is myoglobin, the protein found in muscles, is broken apart from the muscle, ends up in the blood, ends up being filtered through the kidney, and ends up in the urine. So myoglobinuria indicates that there is muscle damage somewhere in the body, and this in itself can contribute to damage to the tubular system within the kidneys. And some of the other chemical events occurring as part of this major inflammatory response can also damage the kidneys and lead to kidney failure. The body will undergo a general adaptation syndrome response or stress response inevitably during a burn. They'll be susceptible to infections. There's a number of reasons why this is, but one of the examples is that the skin, we know, is our first line of defense. And if it's damaged with a burn, then you can become susceptible to many different pathogens that otherwise we would be able to resist. The other thing I wanted to mention about hypovolemic shock, I had mentioned that fluid shifting from the vessel space can lead to hypovolemic shock, but the inflammatory process that occurs and all these mediators that are released further promote leakage of fluid from the vessels into the tissue. So really making the vessels more permeable than they should be. This image demonstrates the fluid and electrolyte shifts that are associated with burn shock. So at the top here, it's showing you during burn shock, and then at the bottom after burn shock. You can see a capillary and cell. Normally, the movement of sodium and potassium inside and outside of the cell is controlled by a pump, and during a burn, that pump can be disrupted. We can also have movement, so we get this abnormal movement then of electrolytes, including potassium, which can enter the blood vessels, leading to hyperkalemia, and hyperkalemia can affect organs that work on electrical gradients. So it can affect the heart, leading to arrhythmias. It can affect the brain, leading to seizures. Capillaries can release potassium, water, sodium, and albumin. Albumin, remember, is that protein that should normally remain in the vessels to keep fluid in the vessels. So if albumin is leaving damaged vessels, then water will follow. And so as we'll see with the next slide, really the biggest concern here is hypovolemia, losing water volume, fluid volume from the vessels where it leaves into the interstitial space. Now, after burn shock, we're talking, say, 24 or so hours after burn injury, the overall capillary integrity can be restored through a mechanism that's not entirely known, which can allow for some better control of the shift that we just saw between fluid and electrolytes. But albumin can remain interstitially, because it is such a large protein that would have difficulty getting back into the capillary that it came from. Some of the major events that occur with an acute burn injury are summarized in this flow chart. We know that we're going to get direct tissue injury, that's obvious, and capillaries being damaged as well, becoming more permeable. When this occurs, it leads to edema. Acute burn injury also causes a systemic injury response where not just the specific area that was injured is going to become more permeable, that is the capillaries in that area, but other capillaries as well, further leading to edema. And depending on how much loss there is of fluid, the big concern, as already mentioned, is hypovolemia. And also, when we lose fluid from the vessels, it's going to make the blood that normally stays in the vessels more viscous, hyperviscosity, because we've taken away the fluid that would normally dilute it. All of this can lead to tissue ischemia, a reduction in the blood flow to a tissue to allow it to survive. And so some of the major effects that can be seen then with an acute burn injury that progresses, the big concerns aside from hypovolemia is going to be acidosis, so the body can't regulate its acid-base balance, a reduction in cardiac function, not able to pump enough blood to the rest of the body for survival, and multi-organ dysfunction, where multiple organs in the body are unable to function properly, all because of an acute burn injury. And of course, I'm talking about more than just a sunburn. When I say acute burn injury, we're talking about more of a major burn. The final thing I wanted to mention is the two very important factors in determining what the overall effect will be when it comes to a burn injury has to do with, one, the extent of the body covered, and I talked about the percentages earlier in this lecture. And then the second factor is the depth of burns. We're talking about the cutaneous depth. How deep is the burn? So extent of body covered and depth of burn then are two very important factors in determining the effect or the results, what we'll end up seeing when it comes to a burn injury. That's all for this lecture. Thanks for your time.